So continuing with our used car analogy, we still have the same four vehicles we chose from our favorite used car lot. But now let's look into the risk we'd be assuming with each vehicle if we were to purchase it. To determine the risk, we have to take a lot more into consideration than just the price alone. So in this chart, we'll examine some additional factors that are important to us. We want to make sure that we can drive the car for a while, so we're concerned about the mileage on the odometer. There are some features that we're interested in having, so those are a plus. And we want to get as many miles out of a tank of gas as possible, so miles per gallon is important as well. For each of these categories, we'll set a predetermined scale so we know how beneficial each choice would be. As far as overall mileage is concerned, the lower the better, right? So let's say anything under 50,000 miles gets first place, 50,000 to 100,000 gets second place, 100,000 to 150,000 gets third place, and 150,000 to 200,000 gets fourth place. Now let's look at the features. Remember, the more features the vehicle has, the more points it will get. So a couple of cars have most of the features we're looking for. One of the cars has a few, and one car, well, let's just say that power windows aren't as standard as you might think. Scoring these choices, the premium trim comes in first place, the limited trim with most of the features we're looking for comes in second place, the luxury trim comes in third place, and Mr. Manual Crank Window base model comes in last place. Now we've got to keep gas in our new ride, and working our first job isn't exactly lucrative, so miles per gallon is really important. The higher the better, so those hard-earned dollars take us farther. Anything 10 to 15 miles per gallon comes in fourth place, 15 to 20 miles per gallon comes in third, 20 to 25 miles per gallon will take second place, and anything over 25 miles per gallon will make first place. Now that we've scored each category, we can total these scores to see which vehicle choice would be a high-risk decision and which is a low-risk decision. We assess patient risk in the same way. Some patients are young and healthy with few or no active diagnoses, but some are elderly patients with multiple diagnoses and comorbidities. It's safe to say with relatively low risk that a young and healthy patient won't spend much money on healthcare each year, while saying an elderly patient with multiple health concerns should have a low healthcare budget, that's a risky statement indeed. There are also things we can do to mitigate this risk, but the first step is to determine the risk level of the patient. This is where stratification and risk adjustment comes into play. In the next video, we'll examine how this process comes together.